So when you're under stress, your adrenals fire, you're supposed to have high blood sugar, right? To keep you alive from the tiger or the theoretical tiger chasing you down. Now, if you have chronic sugar in your blood, that's really dangerous because the sugar can cause what's called glycation damage, which is another Scrabble word for caramelizing your blood vessels, which leads to bad things like your vessels cracking and leaking and internally bleeding, which is why the body will plug up the holes with cholesterol to stop it from internally bleeding. Okay? So if your body had the choice between internally bleeding to death or throwing it into the fats, the sugar into the fat cells and make you obese, which would you pick for survival sake? Not cultural sake, survival sake. You'd pick the obesity. Or the other option is you throw the sugar into the muscle cells to be burned very quickly. The problem with burning sugar very quickly in the muscles is that A, you use up all your B vitamins, B, you create lots of lactic acid, which is that chemical that makes your muscles sore when you work out. But now imagine your muscles are sore all the time, everywhere, for a period of time. What do you call that? Fibromyalgia. If you use up all your B vitamins, that means you have no B vitamins left over to make serotonin from tryptophan, and we call that depression. And you don't have enough B vitamins to convert serotonin to melatonin, therefore you can't sleep. Also, if you burn sugar very quickly, you only get 1/18th the amount of energy you should because you're using the fast burning pathway, not the slow efficient pathway. You operate on 1/18th the amount of energy, and if you operate very tired all the time, what do you call that? Chronic fatigue. So now do you understand why these women all had fibromyalgia, chronic fatigue, insomnia, depression, and other things all at the same time? Okay? So that's a 35-minute video on my website. Brainless brain rehab, how to rebalance the brain. So there's many ways to do it. One is through smell. So if you're hyper right-brained, usually females with chronic fatigue and whatnot, they're usually hyper right brain. I've treated only a couple people who had hyper left brain but also had chronic diseases, but that had to do with hyperactivity of the same side cerebellum, and it just gets really complicated, but it does happen. And that's a neurological discussion we don't have time for. But typically if people have chronic diseases, they're hyper right brain. And so what that means is that you've got to put a pleasant smelling aroma, pleasant to you, because smell is the most individual sense in the whole body. Pleasant to you, you put a drop not in your nose but on the upper lip underneath the nose, and make sure that the oil is cut so that it's not so strong it's going to burn your skin, which some oils do, and it's clean oil because it's going straight up into your brain. You just put a dab under the nose, not in the nose, and you breathe as normal, and that the smell will preferentially stimulate the left side brain if you put the drop under your left nose. Okay, brainless brain rehab, very cheap. You can get clean aromatherapies. You can cut them with almond oil or apricot kernel seed oil if they're too strong, and just carry it around. It'll last you months and months and months. You just change out smells every couple hours when you get used to the smell.
How do you know if you're right brain dominant? Is it because of those symptoms?
It's almost all patients who have chronic fatigue issues, myself included, are hyper right brain, even if they're male. Very few exceptions, they're hyper left brain, and if they are, it's almost always it has to do with it gets too complicated, but basically you can safely assume that you're hyper right brain if you have a chronic issue.
If you've not got any issues, does that mean you're
Say what?
don't have issues
If you don't have issues,
of fatigue, things like that?
then usually what you may not be hyper right. The issue, okay, I guess I have to explain this. People who have really chronic diseases, it's not just like all women are right brain and they all get chronic diseases. What happens is that you've got your upper cortex and you've got your cerebellum, which is your balance center. You can have a left and right brain cortex, or you can also have a left and right brain dominant cerebellum. If you have the same side cortex is as strong as the same side cerebellum, you almost always have a chronic disease. Okay, and that's where it gets complicated, and that's where coming to see a functional neurologist like myself is very useful, because no one's diagnosing this. Only one other person in the country, and she's like up on the North Shore or something. And what happens is that when you stimulation from the right side of the body will strengthen the right cerebellum and then cross over and feed the left brain. Stimulation from the left side of the body will strengthen the left cerebellum, cross over and strengthen the right cortex. The problem is that if you've got them on the same sides, no matter what activity or therapy or intervention you get, you're either going to spike the cerebellum out of balance or you're going to spike the cortex out of balance. And that's why it's very hard for them to get better, because there's a brain mismatch in terms of information. You need opposite. If the cerebellum and the cortex are weak on opposite sides, these people get better so quickly, because all you do is adjust on one side and it strengthens that cerebellum and the opposite cortex, and everything is wonderful. Absolutely. That's the fastest, best way to actually change the neuroplasticity of the brain, is an adjustment. Yes. A chiropractic adjustment is to do that. Because when you adjust a joint, you send a massive neurological barrage up into the same side cerebellum, and it crosses over and feeds the opposite side brain. So my patients who have chronic issues, I almost always adjust them on the right side of their body, because it will feed their weak left brain. But if they have a weak, if their cerebellum is screwed up on, if it's already too strong on the right side, I have them do left-sided cerebellar exercises first before I adjust them, so I don't spike out the cerebellum. And again, this is probably, people's heads are spinning with this discussion, but this is where having a clinician overlook your care is very important, because the brain level issue is not discussed, much less treated. And this is why women get the chronic diseases, and they're not dealing with the brain level unless they're trained. So I say what?
The social side of this, women have a more empathetic role in society.
No, absolutely.
And so because of that,
Yeah.
it's overstimulated in many cases, single mothers.
But that's exactly why, if you're already right-brained to begin with, and then there's all this pressure on you from all angles, then it just compounds and compounds and compounds. Then you throw in a weak cerebellum on the same side, then you just get, everything gets all mismatched. Okay, so it's like I've treated several women who have the opposite thing, and they don't have chronic diseases. They just don't. In fact, I can't think of a single example in clinical practice of someone who had a chronic disease that had the opposite cerebellum was weak to the opposite cortex. I mean, it's just such a pattern. How do you test for that? Are you testing for it? Yes, I am. I do soft. Well, you can see it, but also there's soft neurological signs. There's you can check people's cerebellum by doing push tests, sway tests. Have them close their eyes, see which way they go. You can have them do, this is another Scrabble, dystiodocokinesis, where they turn their hands over fast. And then the cerebellum that's weak, what will happen is, my left, you can see it, it just starts flapping in the breeze, okay? But you're gonna trick you got to keep your fingers together. If you do this, you're not, it's like, and this is checking for weak cerebellum, and you'll see that one will just flap out. Or they'll just kind of like wither, there, okay, like that, yeah. So, but keep. It's easier to see if you keep your thumbs and fingers like this, not spread out or like that. There's dozens of tests. Okay. So, and look, eventually I'm going to be putting this all online into an online program. Like I'm designing an online adrenal fatigue recovery program, okay? And so this is you're getting the beginning stages of it.